Assalamualaikum and hi. Today our group will be presenting about endocrine system. So endocrine system is basically a network of glands in our body that makes hormones that help cells to talk to each other. What I may talk here is they communicate what they need to do in order to maintain the homeostasis of our body and other function as well. So they are responsible for almost every cell, organ and function in our body. The glands of endocrine system are where hormones are produced, stored and released. Each gland produces one or more hormones which go on to target specific end tissues in our body. So the function of endocrine system are these three. First, they makes hormone that controls metabolism like thyroid gland. They produce thyroxine hormones to control the metabolism. Also growth and development like thymus. They produce typomycin to control this function, as well as this other function down here. This endocrine system also controls how our hormones are released, and they also send those hormones into our bloodstream so they can travel to other body parts. Right now we move on to the parts of the endocrine system and their position. So there are many glands that make up the endocrine system. We have the hypothalamus, pituitary gland and pineal gland in our brain. So click this link to see the close-up image. The thyroid and parathyroid glands that are in our neck here. So these glands and organs are actually at the anterior neck of our body. This is the thyroid gland, and these are the parathyroid gland. Onto the abdomen part here, we have the thymus, which are located in between our lungs. This is the 3D diagram of the thymus. The interesting thing is that we have layers option here. The layers option can make us see the every layer that we have in our body. So we can see that our thymus is really behind the sternum here. And then we move on to the adrenals that are located on top of our kidneys. Okay. Adrenal is actually known as suprarenal glands. This is because it is actually located at the adjacent of the renal, that is our kidney. Next we have pancreas. Pancreas is located behind our stomach. So pancreas is actually oblong shape here. So it has 5 parts that are the head, the neck, body, tail, and also uncinate process. Moving down here, we have ovary for the female reproductive organ or endocrine organ, and in male we have testes. So we're looking at the ovaries first. Here it is. This is the ovaries. The ovaries are a bilateral pair of flattened, egg-shaped peritoneal discs that reside just within the true pelvis. Take a look on the male endocrine organ that is called the testis. Originally, it is located on the posterior abdominal wall During embryonic development, they descend down the abdomen and through the inguinal canal to reach the scrotum. They carry their neurovascular and lymphatic supply with them too. So these are the picture. It has several layers.
Types of glands and their functions. Hypothalamus glands. It will release hypothalamic and inhibiting hormones. The target tissue is anterior pituitary. It regulates anterior pituitary hormones. Parathyroid gland. Parathyroid gland will release parathyroid hormones. The target tissue is bone, kidneys, and intestine. The function is to maintain amount of calcium in the bloodstream and tissues that depend on calcium for proper functioning. Thymus glands. Thymosin, also thymopoietin and thymolin will release. The target tissue is T lymphocytes. It accentuates the immune response as well as stimulating pituitary hormones such as growth hormones. It also assists in the process where T cells differentiate into different types. Pituitary glands. It releases luteinizing hormone, follicle stimulating hormones, growth hormones, oxytocin, and prolactin. The target tissue is ovaries, kidneys, uterus, and breast tissue. It controls estrogen and testosterone production as well as ovulations. It also controls the production of eggs and sperm. It plays a role in growth and divisions. It helps with lactation, childbirth, and mother-child bonding. It also promotes breast milk production. Pineal glands. Melatonin will release. The target tissue is many organs and it controls sleep and wake cycles. For thyroid glands, it will release thyroxine hormone. The target tissue is liver and the function is to help to control the rate of metabolism and energy levels. Adrenal glands. It will release adrenaline, aldosterone, cortisol, and DHEA hormones. The target tissue is many organs. The adrenal glands is to increase blood pressure, heart rate, and metabolism in reaction to stress. It also controls the body salt and water balance. It plays a role in stress response and is in production of body odor and growth of body hair during puberty. Pancreas. It releases glucagon and insulin hormones. The target tissue is at liver and it helps to increase levels of blood glucose, also helps to reduce blood glucose levels. Ovaries. It releases estrogen and progesterone. The target tissue is uterus. Ovaries works to regulate menstrual cycle, maintain pregnancy, and develop female sex characteristics, also aids in sperm productions. Ovaries also helps to prepare the body for pregnancy when an egg is fertilized. The last one is testes. Testosterone will release. The target tissue is reproductive organs. Testes contributes to sex drive and body density in males and females, as well as development of male sex characteristics.
Endocrine disease and disorders. Your endocrine system includes 8 major glands throughout your body, such as the pineal gland, the thyroid gland, the pituitary gland, and the adrenal gland, pancreas, parathyroid gland, testes, and the ovary. This system affects the growth and development, metabolism, sexual function, and mood. If your hormone levels are too high or too low, you may have an endocrine disease or disorder. Endocrine disease and disorder also occur if your body doesn't respond to hormone the way it's supposed to. And here is a picture that shows you all the 8 major glands throughout your body. Type 1 diabetes. It's a chronic autoimmune condition where your pancreas produces little or no insulin and the crucial hormone that helps convert the glucose in your bloodstream into fuel. Type 1 diabetes it's usually diagnosed before the age of 40, although occasionally people have been diagnosed later after an illness causes an immune response that triggers it. In the US, most type 1 diabetes diagnoses occur in children between the ages of 4 and 14 years old. The most common causes of type 1 diabetes, such as uh, viral infection, researchers believe that type 1 diabetes can be triggered by a virus, a common flu, or cold. A common flu or cold. Injury to or removal of the pancreas. Very rarely, type 1 diabetes can be triggered by an injury or a trauma to the pancreas. Whenever the pancreas is surgically removed, the body also loses the ability to produce insulin, which then causes type 1 diabetes. Type 2 diabetes occurs when your blood sugar level become elevated and you develop insulin resistance. When you have type 2 diabetes, your insulin response no longer function as it should, and this causes the following to happen. 1. Your muscles, liver, and fat, also known as the peripheral tissue, become insulin resistant, which means they do no longer respond to insulin and are unable to absorb and use glucose. 2. The beta cells in your pancreas become exhausted and can no longer produce sufficient insulin. What are the signs and symptoms of type 2 diabetes? 1. The polydipsia is an excessive thirst that's stronger than feeling you get on a hot day, and the hyperphagia is an unceasing hunger that is more bottomless than the hungry feeling you get after skipping meals. Weight loss can affect some people with type 2 diabetes and could be a warning sign if you have not changed your diet or exercise routine. The blood feeding it can come on quite suddenly and may also come and go because it's a result of high blood sugar levels that causes the lens of your eye to swell. The headaches are often moderate to severe and may occur frequently. Treatment of diabetes. Treatment of diabetes involves lowering blood glucose and the levels of other risk factors that damage to blood vessels, as well as quitting smoking to avoid complications. Other cost-saving interventions include preventive or temporary treatment of diabetes as follows. One, the moderate blood glucose control. People with type 1 diabetes require insulin. People with type 2 diabetes can be treated with oral medication but may also require insulin. Monitoring level of blood pressure, foot care, and undergoing screening for diabetes retinopathy, which causes the blindness. Blood lipid control to regulate the cholesterol level. Screening for early sign of diabetes-related kidney disease, and these measures should be supported by a healthy diet, regular physical activity, and maintaining a healthy weight and avoiding tobacco use. Endocrine disease. Endocrine disease. Continue. The Cushing syndrome, it's an uncommon hormonal disorder caused by a high level of, cortisol in the blood for a long time and occurs in all ages. Causes excess level of the hormone cortisol are responsible for Cushing syndrome. Cortisol, which is produced in the adrenal gland, plays a variety of roles in your body. For example, cortisol helps regulate your blood pressure and keeps your cardiovascular system functioning normally. Cortisol also helps your body respond to stress and regulates you uh, the way you convert metabolize protein and carbohydrates and fats in your diet into usable energy. However, the increase in the hormone cortisol is due to several reasons, including the pituitary gland and adrenal gland tumor may be maybe maybe begin tumors. The use of the corticosteroid drugs for a long time for the treatment of inflammatory disease such as lupus and rheumatoid arthritis. Risk factors: 6. It's more common in women, especially those between the ages of 20 and 50 years old, and obesity and having type 2 diabetes and hypertension. And the sign and symptoms of Cushing's syndrome can vary depending on the level of excess cortisol, including weight gain, particularly around the waist and upper back, in the face and between the shoulders. Pink or purple stretch marks on the skin of the abdomen, thighs, and the breast and the arms. Thinning, fragile skin that bruises easily, and the acne and the severe fatigue and muscle weakness, slow healing of wounds, and depression and anxiety.
The most common endocrine disease is diabetes. Diabetes cannot be cured, but if the patient follows healthy lifestyle and a healthy diet, then diabetes can be controlled. We have apps which can help patient to live healthy lifestyle, such as a coaching platform to help support daily management, such as WellDoc, Bluestar, Livingo, and Lark. Data integration platform to sync with other glucose management devices like a Gluco, Cornerstone for Care, OneDrop, and MySugar, and decision support platforms which can help users make best decision with glucose management, such as Sugar IQ, bolus calculators. The blood glucose of a diabetes patient can be measured with a blood glucose meter. It can be used easily at home. Nowadays we have continuous glucose monitoring devices which can measure the blood glucose at regular intervals throughout the day. Nowadays we have smartwatches which can help the patient exercise, get better sleep, track pulse, track blood oxygen level. The blood glucose monitoring isn't supported yet, but will soon be, which can help the patient to live a healthy lifestyle and to control its blood glucose level. For more accurate blood glucose screening, doctor prescribes blood test, but it's a bit more hassle and cannot be done at home at a regular basis. First is fasting blood glucose test, which is blood is drawn in the morning after we go out without food overnight or at least 8 hours. Then oral glucose tolerance test. This test is also done in the morning after going out without food overnight or at least 8 hours. Blood is drawn before we drink 8 ounces of sugar solution and 2 hours after. This test is more precise but less convenient than fasting blood glucose test. And another one is hemoglobin test. This shows what our average blood glucose levels have been over the past 8 to 3 months. We can eat and drink normally before the test. Most endocrine diseases are screened by blood tests, such as Cushing disease, which can be diagnosed by blood, saliva, or urine test by determining the presence of excess cortisol.